Working with children, first aid and incident reports. First aid. Staff should administer first aid when an injury occurs to a camper or staff member with the skills they use not to exceed those learned and certified for in their first aid and CPR courses. First aid should include treatment of minor cuts, bumps, bruises, burns, bee stings when a child is not allergic, and similar injuries. For any injury to the neck, back, or eyes, second degree or worse burns, broken or possibly broken bones, or any life-threatening condition, staff should immediately contact 911 and administer first aid not to exceed skills learned and certified in their first aid and CPR courses until emergency services arrives. It is mandatory that staff wear first aid gloves, which are provided in our first aid kits, when providing first aid with any injuries that include bodily fluids. If an incident occurs that results in a spill of infectious waste or bodily fluids, staff should contact maintenance staff for cleanup and removal. If there is not a maintenance staff available at your site, staff must use techniques taught in staff training to clean up bodily waste, vomit, spilled blood, or similar items. Scratch and bump notice. If a child gets a minor cut, scratch, bump, bruise, or similar minor injury in which we are able to administer basic first aid, and the child may then continue to participate in regular camp activities, complete a scratch and bump notice and hand it to the parent at sign out. Parent notification of incidents. For more serious injuries or for repeated problematic behaviors, fights, or serious incidents, the site director must complete an incident report parent notification form. Depending on the seriousness of the incident, the site director may notify the parent at sign out, or management may choose to telephone the parent. For very serious injuries or incidents, a much longer and detailed report may be required. Remember, this is a legal form and may be used in a court of law.